Hey, Dr. John here. I'm back. It's been a busy 2021. Sorry if you missed me. But here I am sitting in one of my wonderful treatment chairs that I see a lot of my at-risk or high-risk foot care patients. These are the ones that have the thick fungal toenails that are brittle and yellow and oftentimes not so pleasant to look at. But it seems like you all want these type of videos, so here you go, another fungal toenail video. Now let me explain. As podiatrists, foot and ankle specialists, we see a lot of fungal toenails, and we see a lot of patients who are at high risk, and therefore they come in on a regular basis to have their toenails debrided or debrided, trimmed. More than likely, this is not really a trimming, because when you've got a thick fungal toenail, it's a lot more than just a simple little trimming. And now, let me emphasize, this is not a pedicure. I am not a pedicurist. I don't want to be pretending that I'm going to make your toenail pretty. Pedicurists do a great job of making toenails look beautiful. Plus, you don't want me painting your toenail. The main purpose of palliative foot care, either being diabetic foot care or routine palliative foot care, is for those patients that are at high risk, meaning they've got poor circulation, or they may have neuropathy where they cannot feel their feet as normal, or they've got certain conditions that really they are not at a good position to do their own foot care. That's when they need to see a doctor such as myself to make sure that we're checking their feet, make sure that their toenails are trimmed properly so that they don't cause other problems. What other problems could be caused by a thick fungal toenail? Well, if they become ingrown or they put pressure on the toe, causing a bacterial infection. So a fungal infection of the toenails really isn't going to make somebody's toe fall off. But if they are being secondarily causing a bacterial infection, which is an ingrown toenail, or if they have an ulcer, yes, then that's when they could actually lose their toe. So believe it or not, in the United States, Medicare does cover palliative high-risk foot care. You have to meet certain requirements. So if you think that you possibly could qualify, make sure you see a foot and ankle specialist podiatrist to see if you actually qualify for that care. I will emphasize, just being diabetic does not make you automatically qualified. So see your doctor, see if they will determine whether you qualify for regular palliative foot care. So in this video, I've got a patient who hadn't been seen in about 6 months, and well, I'll let the video speak for itself. So I've got this patient who came in, again, hadn't seen him in about 6 months. You can see that, I'm checking in between his toes, making sure that there's no macerations, is what we call it, where the toes are a little bit, the skin between the toes is whitish and moist. As you can see, I'm clipping off the great toenail here. A lot of it is loosened up off of the nail bed, not really even attached. The fungus has eaten away at the nail bed and pretty much made what we would refer to in common language as good old toe jam. It's moist. It's pretty much lifted the nail completely off the nail bed. And you can see as I'm trimming, none of it's bleeding. I'm not causing a wound. Yeah. Now, if we had a normal nail here, and we try to do this, we would be bleeding all over the place. But because the fungus has separated the nail plate from the nail bed for the most part, now, we can trim off a lot of this looseness. Now, I'm getting down to the area where it is attached. Where it's attached We don't want to go past that because that will bleed. But again, as you see, it's thickened, it's crumbly. The fungus has just eaten away at the nail plate. And again, the fungus is typically a dermatophyte fungus. It infects the nail plate, the nail bed where it lies, and in this case, this patient all the way back to the nail root or the nail matrix. So I'm just trying to debride as much of this nail back as possible. On to the second toenail. As you can see, that is sharp like a dagger almost. It's amazing that he didn't rip this toenail off. A lot of times patients will come in and that toenail will catch on something and off it goes like a bottle cap. But luckily he didn't do that. Now if you notice right underneath here, and this is kind of like right where my nail nipper is, this is not nail. That is not nail. That is thickened skin that has built up underneath the nail plate. The nail itself can, and the nail bed can get pinched up and it can callus right there. All of that right there is not nail. Now I'm going to trim back as much as I can, but I don't want to go crazy with it because if I do, it'll start to bleed for sure. On to the third toe. And as you can hear from my nail nipper, these are pretty thick. The fungus, the poor circulation, the age of the patient all contribute to that thickness. This patient happens to be diabetic as well. The diabetes will start to affect the skin. You won't see any hair on the toes because the circulation is poor. The skin gets dry, scaly. That is also part of fungus as well as just the lack of moisture within the skin. And here again, another piece of that skin right underneath the nail bed. I'm going to try to take off as much of that callus portion, but I don't want to go too far into that. All of that will bleed if I start to dig in and start to try to trim that. And that's where most diabetic patients will get into trouble. They will try to trim all that, and they can't really feel pain. So once they cut their toenail, it starts to bleed everywhere. And that's kind of where that all comes from. That they just cannot feel that extra skin that builds up. Now again, I put my thumb or finger over the nail nipper every time I cut because I just don't want a random toenail to go flying up in the air and hit me in the face. So forgive me if I don't give you the satisfaction of seeing it fully cut without my finger over the nail nipper. Last one, little pinky. A lot of times this just comes off in one good cut, and sure enough, it almost pretty much does. Again, look at this patient's skin just behind the toes. It's all dry, scaly. Dremel it just to get all the rough edges off. Got a vacuum to help suck up some of that nail dust there. And again, I don't really, again, you can debride or Dremel this all the way down if you really wanted to. But my goal is just to get the rough edges smoothed down so they don't catch on his socks. Little alcohol to wipe everything down. Definitely want to go in between the toes. You can see all that extra skin. A lot of it due to just poor hygiene as well. I mean, the patient, unfortunately, didn't have the best hygiene in general. And believe it or not, some of these patients don't really take more than 1 or 2 showers a week. So, again, trying to get as much of that cleaned up as much as possible. And the patient will be seen back in 3 months. Okay, that's good. All right, as promised, here's your consult for fungal toenails. 3 ways to get rid of fungal toenails. Some of this may be familiar, some of it may not. Number 1, there are topical medications that do work to get rid of toenail fungus. Here's the fact of the matter. There's very few, if any, that are over the counter that really work. Why is that? It's mainly because of the penetration of the toenail. That's the most difficult part. We have fungal medications that have been around for a long, long time, and they work great at killing fungus. The problem is getting into and underneath the toenail. How do we do that? Well, that's really only accomplished by more prescription strength medications. These medications are available through your foot and ankle specialist, and really even those medications are not 99.9% effective. There's a couple of factors that are involved. The longer you've had the fungus in the toenail, the tougher it is to get rid of. Number 2, if the entire toenail is infected, meaning the entire nail plate and the matrix where it grows, much harder to get rid of. And then the third thing is any treatment that is done takes a long time. The nail has to grow out, which can take on average 9 months. And then that's a normal nail of 9 months. If it's thick, fungal, I mean, it could take almost a year or more for that nail to completely grow out and reveal a healthier nail. The second one is really, and this is not what most people want to hear, but it's the oral pill. The oral medications do work well. There are 2 main ones that you can talk to your doctor about that work well. One is a common one that hits the fungus, the main fungal elements dead on, like a 45 hitting it. The other medication is a shotgun approach. It covers a lot more fungal elements, but it doesn't hit it as hard. Both of these medications are typically a 3-month course, and you do have to have a liver test at least on the first time that you take it, and making sure that you have a baseline liver test done. The third treatment is laser treatment. Now, fungal lasers have been out there for a while. This is the truth of the matter. Fungal lasers don't work 100% of the time. They're still on par with, the patient's number, whether they have a fungal infection for a long time, if they've had a fungal infection that involves the entire nail. So the success of laser treatment on a fungal toenail also depends on those parameters. So if it's been there for about 3 or 4 months, fungal laser topical work great, and it will eliminate it very well. If you've had it for several years, it could take several treatments to be able to get rid of that toenail fungus. And then I have some patients who come and say, look, I've had this for 25 years and I've had no treatment. Can you do something for me, doc? Those are the ones that are tough. Those are the ones that really, it is very, very difficult to get any cure, whether it be from a topical, whether it be from oral pill or a fungal laser. So oftentimes those patients may require a permanent nail removal if it's 1 nail or 2 nails. When it's all 10 toenails, that is a difficult case where that's where sometimes just maintaining it through palliative foot care, trimming them, grinding them down, and that may be the only choice. So there are a lot of home remedies out there. Some of them work, some of them are just a little bit of hocus pocus. We have yet to have anything new and significantly innovative yet in the treatment of fungal toenails or onychomycosis. But we do have newer topicals. We have the constant and well-documented oral pill, and we have fungal lasers as an adjunct to any treatment for your fungal toenails. But for patients like this who was in the video here, he's really going to only need palliative foot care. Topical medications may not really work for him, and so he is more than satisfied for just coming in every 3 months and having his nails debrided. So hopefully this was informative, and you know, I don't want to put a damper on your own quest to get rid of fungal toenails, but hopefully this was informative. Make sure you see your doctor. Let them evaluate you and get a really good feel of whether or not one of these 3 treatments or a combination of those 3 might be helpful. Well, until next time, we'll see you. Have a great, blessed day.